Greg, we did 20,000 plus cases over the past 3 days consecutively. The government, nonetheless, has lifted the travel ban on 10 countries. Despite this, what did the DOH have to say about this?
Charles, aside from the Department of Health, we was able to talk to Professor Dept of Octa Research as well as Dr. Anthony Achon, who both aired their reservations against the lifting of ban to these countries. According to these officials, it's some sort of inflicting more damage or more problems in our current situation amid this increasing COVID-19 cases in the country because of the Delta infection. But the Department of Health highlighted earlier that the lifting of the ban is pursuant to the CDC framework, where these countries have downgraded their risk classification to just moderate. And Vergere even said that there's nothing to worry, as even though we have lifted the ban to these countries, there will be no exemption for the implementation of 10 to 14 days quarantine period, as everyone who will be coming into the Philippines will have to undergo 10 to 4 days quarantine and then testing testing on the 7th day upon their arrival in the country. Charles?
Right. Greg, if we recall from 2 weeks back, we were told by authorities that the effects of the hard lockdown back 2 weeks ago would be felt sometime mid-September. Do we have any updates on the current COVID-19 trends in the country? Are we seeing any of this?
Charles, according to Undersecretary Vergere, we are still seeing some of the effect of the ECQ, which was implemented two weeks prior. But according to Vergere, even as we are also implementing MECQ after the ECQ, the number of cases is indeed increasing because of the Delta infection, and as the active case finding conducted by the local government units is ongoing. Vergere said we are still seeing a slowdown in the increase of COVID-19 cases, but there is still a steep increase in the number of cases in the National Capital Region as well as other areas in Luzon, while we are seeing a plateau on cases from Visayas and a slow increase in Mindanao. Vergere said we might still see more of increased number as the day go by, as we are still facing the infection of the Delta variant of the SARS-CoV-2. Charles?
Right, so much for the COVID-19 response, at least for now. Do we have any updates, Greg, on the provision of unpaid benefits and allowances for health workers?
Charles, according to Undersecretary Vergere, about 14.3 billion peso worth of benefits have been distributed already for the healthcare workers from the period of September 15, 2020 to June 30, 2021. This amount also includes the SRA of hundreds of thousands, of about 400,000 healthcare workers, and as well as their meal, accommodation, and transportation allowance, as well as other allowances due for the healthcare workers amid this pandemic. Vergere also said that they are still waiting for the special allotment release order from the DBM for the 800 million peso worth of budget for the about 100 healthcare workers who are still pending to receive their special risk allowance. And Vergere said as soon as they have received this SARO, they will immediately distribute it to their regional unit for these units to distribute or transfer the money to the involved public and private facilities for them to distribute the special risk allowance to their eligible healthcare workers. Charles?
Thanks for those updates and stay safe, Greg. That was Greg Gregorio reporting live from Antipolo.